Hello everyone. Our topic today is healthy adults versus diabetes as well as osteoporosis. I'm Chris Ragaseo.
I'm Allison Dwyer.
Taylor Cruzel.
Allie Gallagher.
And Braden Real.
Just going to check and see if this camera's on us properly right now. Just make sure. Yeah, we're good. All right. Let's roll. So what is diabetes exactly? Diabetes is a chronic, lifelong condition. It's a cardiovascular disease. It affects the body's ability to utilize energy from our food, specifically glucose, and we're going to get into a little bit of that later. And we're also going to get into the different types of diabetes, how we acquire each type, and exactly what they affect and what they do to our body. So to start, we need to understand what glucose is in our bodies and how we use it. So glucose is what our cells use for energy. And the molecule for glucose is this simple sugar right here. So glucose is obtained when we eat carbohydrates. Carbohydrates can be found in every type of food we eat. It's one of the main macronutrients. It's mainly found in breads, fruits, vegetables, nuts, processed food especially, and dairy. Like I said, it's the most abundant macronutrient. And carbohydrates are made up of long chains of glucose, as you can see here. So when we ingest carbohydrates, our body begins to break them down with the saliva in our mouth, right down through our intestines, to try and break it down to a simple sugar like glucose, which is what we absorb into our bloodstream, we absorb into our cells, and what our cells use to function. So let's just take a look at the role of insulin. And then we'll discuss insulin in a sec.
When food is ingested, it travels along the digestive tract, where it is broken down into its component nutrients in order to be absorbed into the bloodstream. One such nutrient is glucose, a simple sugar. Glucose gets absorbed by the stomach and intestines and then enters the bloodstream. It travels through the circulation to all body cells. Once absorbed into the bloodstream, glucose circulates, causing the blood sugar level to rise. An increased level of blood sugar sends a signal to the pancreatic beta cells, which respond by secreting the hormone insulin into the circulation. Insulin is necessary for glucose to reach and be used by several important target tissues throughout the body. These include the liver, muscle, and adipose tissue. Insulin is necessary to keep blood glucose levels stable in the body. Glucose enters the cell through a process called facilitated diffusion.
So as you saw there, when our blood glucose level rises from ingesting things like carbohydrates, we need to absorb it and get it out of our bloodstream into our cells. And in order to do that, we need insulin, which is produced and secreted from the pancreas. So that's kind of the precursor of what we need to know in order to understand diabetes.
Thank you, Chris. I'm here to talk a little bit about type 1 diabetes. There's two types of diabetes, type 1 and type 2. I'll be discussing type 1, and then Taylor will discuss type 2 later on. Type 1 diabetes, it's the inability to produce insulin, and you're born with it, so it's genetic. You can receive this from parents or past grandparents, and it stays through the family line. What makes it what it is it destroys insulin-producing cells in the pancreas. As I said, it's genetic, and most people are diagnosed in their early or late teens and then into their early 20s. It's been known that you can get this from exposure of certain viruses, and these viruses are Coxsackie virus B, rubella, and mumps. Some of the symptoms of type 1 diabetes is thirst, and it's an excessive thirst, not just like after a soccer game being thirsty. It's constantly throughout the whole day, and you never seem like you can quench that thirst. The second one is frequent urination, and that goes hand in hand with thirst. If you're going to be drinking that much liquid, you're going to have to urinate a lot. Weight loss, fatigue and weakness, and blurred vision. And me personally, I went through I was tested for type 1, and my major symptoms were thirst, frequent urination, and weight loss. So the way they test you is they take a blood sample, and that's what they look like. You get between 2 and 3 of those, so they can send those out to a lab. And when they test them, they're testing for your glucose level. And you have to fast for 24 hours before you can be tested, so they can get an accurate test of the glucose level. And also, there's a urination test, and they test the same thing. They test their glucose levels. And I'm going to pass it off to Taylor.
Okay, thanks, Braden. Okay, I'm going to talk about type 2 diabetes. Type 2 diabetes is the most frequent type, and out of type 1, which is also known as juvenile, it's also gestational, which occurs when a woman is pregnant, is the leading cause of death in the United States. And just like the symptoms of type 1, there's also other things such as tingling in your hands and your feet. Type 2 is most commonly a lifestyle disease, but you can also get it through heredity. We have physical inactivity and poor diet as some of the main contributions to developing it. This is when your blood glucose levels are higher than normal, and your body does produce insulin, but it does not know how to produce it or use it effectively. And then your body is forced to produce extra insulin because it's not going where it needs to. And then over time, your body can't produce enough to keep up, where your levels need to be stable. And then it's important for people to get active and change their eating habits, lose weight, and get treatment. Doctors can prescribe you pills or insulin. Some people need both if their levels are that big of a problem.
So what we see here is the incidence rates for type 2 diabetes over the past few decades. So like Taylor said, type 2 is really a lifestyle disease. It's brought on from poor diet and lack of physical activity. So as you can see, kind of throughout the 80s into the early 90s, it wasn't really one of our more serious illnesses. But as our lifestyles started to change, the introduction of a lot of fast food into our diets, things like that, people becoming more sedentary, especially at work, you can see how type 2 diabetes has skyrocketed to where we are today. So this is a pretty significant graph showing exactly the trend of what is happening in our societies. And then here we have a graph showing where in the United States diabetes has the highest incidence. So if what we can deduce from this is it has a lot to do with our culture. So in the southern part of the country and in the more eastern part where cities are a lot more dense, there's a higher incidence of diabetes, and that's mainly due to diet. So as we know in the south, a lot of fried foods, a lot of takeout, a lot of fast food, especially into our bigger cities as well. People are always on the go. So that's why in those areas you're seeing some of the highest rates.
Okay, and on top of what Chris has just mentioned, things such as technology developments can be added on to that. People have become more dependent on getting things quick and easy, making them more lazy. But in terms of the 8 dimensions of wellness, we have listed the different limitations that are brought on by having diabetes. And the first one we have is financial. And diabetes is one of the most expensive healthcare costs. And if you look up here, we have about in 2013, the statistic was that $250 billion in healthcare costs were spent towards diabetes. But if you look at your handout sheet, we have it's about $344 billion the past year. And then the American Diabetes Association also provided us with statistics such as we have inpatient care costs about 43% of the cost, medications and supplies 30%, and then doctor's visits and facility stays are a total of 18 together. And here's some interesting quotes also provided by the American Diabetes Association that kind of describes the issue with financials. And people with diabetes on average have medical expenditures 2.3 times higher than what it would be if you did not have diabetes. And to follow that, this estimate highlights a substantial burden that diabetes imposes on our society. And that's just in terms because this is a lifestyle disease. It can be prevented. It's all about how people exercise, eat. If you're not eating healthy, that's something that you can prevent in life. So next we have Chris.
I think, yes.
All right, another big limitation in diabetes is emotional. It says 21.8% to 60% of people living with diabetes actually are affected by depression. Diabetes doesn't necessarily cause depression. It's the hardships that go along with diabetes that cause it. For example, your activity is limited, you have to take all these medications, and sometimes you may feel angry towards developing this disease, like why did I develop the disease? And you have a limited diet as well, so you're restricted from your fun ice creams and all those like snacks that you used to enjoy. You can't really enjoy that anymore. And next one. Also, other limitations that people don't think about is occupational. You miss a lot of time off of work. You may feel drained and you can't get up in the morning. You have to go to doctor's visits, and this can result in pay cuts. Even some people may get cut from their job entirely. Spiritual, too, also goes along with emotional. It tests a person's faith. So whatever like religion you believe in, it's like, why did I chose to get this disease? Environmental is also interesting because you can't enjoy the city lifestyle or too much because of all the pollutants in the air. And then intellectual, a huge factor of diabetes is your sight gets impaired. And physical, the major physical limitation is hypoglycemia. It's when your blood glucose level gets so low. This is usually brought on by exercising. So what happens is you'll start shaking, you feel weak, you have sweat a lot, tingling in the mouth and fingers has also been reported. And this scares a lot of people with diabetes, so they will say, oh, well, I don't want that to happen to me, I want to exercise. But we'll learn later that you actually can exercise still. And you have higher rates of high blood pressure, high cholesterol, heart disease, kidney-related disorders, and then your lower limbs, especially your feet, will have poor circulation. So have you ever heard of the diabetes socks? Those are special socks to help get the blood flow back in your feet again.
Alright, so our workout rationale. These are specific exercises that people with diabetes can do, and like under the certain constraints that they're allowed to do it, so that they're not under risk, or the least amount of risk possible. All these exercises contain high repetition with low weight or low resistance, and this is the reason behind that is so that they're not pushing themselves too hard, or they won't get overwhelmed with the amount of workout that they're trying to do, and it won't have a negative effect on their body. Also for cardio, you want to stick around 40% of your VO2 max, and you don't want to push yourself too far at first because you want to start off lightly and work into it, and as your body adapts to it, you'll eventually be able to do more raised intensity or go for longer. Some examples of workouts that you can do is 30-minute jog outside or on a treadmill or it matters how physically fit you are, either jog, walk. You can use stair climbers too. And then for muscular strength, as I said before, you're going to do high reps with low weight. And then you're going to focus on the major muscle groups, so chest, back, and legs. You're going to try to stray away from single out specific muscles because it might put too much strain on that specific area. And some examples are lunges and squats. And you can either use resistance bands to raise intensity or dumbbells. But you don't want to use too much weight at first because, as I said before, it might exhaust your body or end up having some negative effects. Also, push-ups, and this is good just with your own body weight because you can go at your own pace and there's no negative effects of it. Like if you drop the weight on you, it won't hurt you. You're just using your own body weight. Ab workouts, that's suggested to use a mat. You can use a medicine ball with those too. And then bicep curls and tricep extensions. You want to use lighter weight for those so you can really focus on that one muscle group, but don't push yourself too far.
So we're just going to bring up real quick some diabetes myths. We've also put some onto your fact sheet as well. So if you want to learn more, you can go to this link and read more about some myths. It's a pretty complex disease, so the more you know, the better. So there's that link for you guys. You can check that out when you feel you have some free time.
Now we're going to transition over to talk about osteoporosis, what it is, who it affects, and some limitations it has on a person who has osteoporosis compared to a healthy body. And then we're going to give you a workout regimen and how to protect yourself from hurting yourself even more. So osteoporosis, what it is it's a skeletal disease in your bones that is characterized by low bone mineral density and changes in the architecture of your bones. In simple terms, it's pretty much when a person has brittle or bones that are more susceptible to cracking. Here we have a picture of normal bone, and then to the right of it is a bone with someone who has osteoporosis. It's most common to a few types of people. First, elderly. It's more found in people over the ages of 50, 60. Women, especially when they're going through menopause. People with low body weight, or someone who may be broken a bone. That bone that is healing is more susceptible to becoming diagnosed with osteoporosis and cracking. A few risk factors of osteoporosis. First, it's usually found in people who do not get enough calcium or vitamin D, which goes along with not getting enough fruits and vegetables. A lot of times people who don't like fruits and vegetables become diagnosed with osteoporosis because they're not getting their calcium and their vitamin D. It's also found in a lot of people who consume too much protein, sodium, caffeine, because those tend to deteriorate your bones if you have too much of it. An inactive lifestyle also weakens the bones. Smoking, as we know, deteriorates the body altogether. Drinking too much alcohol and losing a lot of weight at one time can also help weaken the bones and deteriorate them.
Okay, and then again, we're going to touch on the 8 dimensions of wellness and how they affect osteoporosis, like we did with diabetes. First, we have emotional. There's a lot of emotional effects that come with being diagnosed with osteoporosis. One of the biggest ones is people become more anxious and cautious about just everything in their life because they have a fear of breaking their bones. They're not able to do things they used to love doing. And then that could lead them to becoming depressed, and people start eating too much or too little, which will in turn make them start feeling useless and hopeless. And it's been said that people should be looking for exercises that aren't too strenuous and they're appropriate and approved by doctors. And then there are also physical effects and limitations brought on by osteoporosis. And one of the first ones is it affects your posture and appearance. Under that we have kyphosis, which is when your spine starts deteriorating and curving. And then we have an exaggeration in appearance of aging. People start looking older, and then weight loss is also another big one. We have people feeling tired and fatigued all the time because their muscles and bones are so weak. and they're constantly in pain and achy, and because they're not moving as much as they used to, they start becoming stiff.
Another limitation of osteoporosis would be financially. A lot of people who are diagnosed with osteoporosis sometimes can't go to work as often, so they're not bringing in as much money as they would as if before they were diagnosed with osteoporosis. Broken bones and medications can lead to pricey bills from the hospitals, so that's costly. Occupational, again, that goes with financial. They're not working as often or as efficient, so they can't do their daily activities because their bones are weaker, or maybe they can't do it on their own. And a lot of times when you're at a job, you can't always have that person right there next to you helping you out. Socially, this goes along with intimate relationships. A lot of people are nervous that they will break or fracture a bone, or sometimes they feel bad about asking their friends and family for help. Environmentally, it's hard for people with osteoporosis to go out and enjoy activities that maybe they did, such as hiking or rock climbing, because their bones are so brittle and they're more susceptible to fracturing or breaking the bone. Intellectually, this can mess with a person's mentality a lot. They might be going through stress and anxiety, which can lead to depression, and just as a whole, their mental just decreases. And then spiritually, again, like we said with diabetes, just like any other disease, a lot of people can spiritually and in their mind just think, oh, why me? Like, why do I have to have this happen to me? And yeah.
So while we were researching, we came across some interesting research spearheaded by these two, Dr. Colin Campbell and Dr. Caldwell Esselstyn. So they've actually begun their research on how a plant-based diet can affect positively osteoporosis. So what I mean by that is they've started to uncover some data that suggests that a lot of animal protein, ingesting a lot of animal protein, including milk. So if you look on your fact sheet, you'll see this. A lot of animal protein can lead to osteoporosis. And like Allison said earlier, it was higher protein that has been shown to lead to osteoporosis. So despite what we've been told about how we should drink milk for healthy bones and teeth, what actually happens is animal protein will raise the acidity levels in our body, and in order for our bodies to buffer that, they pull the calcium from our bones to neutralize that acidity. So instead of actually absorbing the calcium from milk, in order to absorb the calcium, we need vitamin D along with it. And because milk contains so many other things such as cholesterol, a lot of fatty acids, we actually can't readily absorb the calcium very well from milk. So instead of helping our bones, our bodies are forced to pull the calcium from our bones to help buffer that acidity a little bit. It's a little bit interesting there.
Okay, so for working out with osteoporosis, it's very important you keep it at a low impact because your bones are so weak. And you want to use exercise bands more so than heavy free weights, because that could get a little difficult to do. Also, you want to use machines over free weights as well. It just provides more safety for someone working out with osteoporosis. Also, what has been found is balance activities and stretching will help a lot. So Tai Chi, yoga, you want to incorporate in your workout at least once or twice a week. If you can't get to classes, there's also at-home stuff you can do. Stability balls are great if you want to practice doing crunches on them, or balancing balls too. You can stand on them, and as you get more used to doing that, you can increase to standing on one leg and even doing squats. And then this is basically an outline of a good workout you can do. So you want to start with cardio, about 40 minutes of walking. And what's unique about osteoporosis, it's better to walk uphill rather than go for a run. It will help build up strength. You can also, if it's not good weather, you can use Stairmasters, ellipticals, and put them on high inclines. Then we also have some lunges, squats, ab gliders. You want to focus on working on larger muscle groups rather than the smaller ones. And then, of course, balance training, again, Tai Chi, yoga, the exercise balls. And thank you guys so much for watching our presentation. We want to leave you with some questions to think about. So first, how can you distinguish type 1 diabetes from type 2? And a little scenario, if your friend was diagnosed with diabetes and they wanted to go on an intense hike, what precautions would you tell them to use so they don't experience hypoglycemia? And then for osteoporosis, what lifestyle behaviors could you recommend to a young woman who has osteoporosis running in her family, so she's at a higher risk for it? Like, what things could she do to prevent it? And touching on what Chris said, for decades, everyone's been told that milk leads to healthy bones and it's a great source of calcium. So what do you guys think of the new findings out there that say that that's not so true?
So, like Ali said, we want to thank you for listening to our presentation. We're just going to pull up our fact sheet real quick and run over that with you. So just give us 1 sec. Can we pause it? Can we pause the video? Okay. Okay, so we went over a little bit of what diabetes is exactly. We went over type 1 and type 2 and the exercise precautions. If you take a look at the graph right here, it'll show you exactly what each area, how each area is affected by diabetes. What's not shown on here is the feet, which is a real important factor when we're talking about diabetes. Because circulation is so limited down there, it is important to have some exercise or have those socks to increase circulation, or else you're going to start to experience some tissue degeneration down there. The breath, especially because we're not burning, it's hard for the body to burn sugars more. You're going to get that smell of acetone, which suggests that your body is trying to burn more fat for energy. Also, the weight loss is huge. So just some other areas you guys can take a look at. We have the complications there, and of course the cost of diabetes, which is so large, especially in recent years. And then we just have some facts or myths for you guys, just some simple ones. You can go through, and like we said, you can check out the link we have on our presentation. Go down.
And then we have our fact sheet for osteoporosis, and we just have an overview and who it affects. Just again, an overview of osteoporosis is when a person's diagnosed of having brittle bones, they're pretty weak, and they're more susceptible to fracturing. Most common, again, to elderly women, people who've just broken a bone, or low body weight. And then we go back to what Allison also talked about, the exercising. Use balance and Tai Chi and yoga that helps prevent yourself from falling. And then we have the graph here that shows more about the milk and how acidic it is to our bodies and which country consumes the most amount of milk. And you can see United States, we're up here at the top. We consume a lot of milk and have a lot of osteoporosis diagnosis. Right, so thank you for watching our presentation. I hope you enjoyed it.
Oh, gotta type in the password. Thanks, guys.